Dr. Nandakumar, a senior consultant working at EMS Memorial Hospital. As you are aware, World Hepatitis Day comes on this July 28th. This year, I would like to highlight certain aspects of a preventable epidemic of hepatitis in our parts. In Kerala, it is mostly hepatitis A. According to the government data, we have got approximately 1,700 people admitted with hepatitis A this year. Contaminated water sources is one of the important causes. Add to that, you have got unsafe food handling practices. Especially a lot of migrant laborers are coming here. A lot of eateries which is unregulated, which contributes to this pandemic. One of those major things which I feel is that when you have raw onions, when you get those things like some mayonnaise and all, which harbingers this virus and gets easily transmitted. One of the paradigm shifts which we see this time around is we see a lot of complications attributable to hepatitis A, which was thought to be usually benign infection in the previous years. We do see patients with having acute pancreatitis, renal failure, and there's a small person requiring a transplant also. So you have to be very, very aware of this. And I would certainly feel that we should take certain precautions to avoid this epidemic occurring again and again. The best way, as you know, is a waterborne disease, is to eradicate the source. So always use boiling water, and especially from outside food. And be very sure with when you use raw vegetables. And third thing is ensure you have got adequate regulatory authorities ensuring that the eateries are well maintained. And of course, to get admitted, if you feel unusual symptoms, say giddiness, feeling slightly jittery or altered sensorium, any complications, undue tiredness, etc., immediately ask for a medical consult. That is very important. And one of the curious things about hepatitis A is actually a vaccine preventable disease also. So we have got good vaccines available. And 2 doses of vaccine ensures adequate long-term protection also. And one of the things which you notice here is there is a paradigm shift in the age also. Previously, it was occurring in young groups, that is less than 10 years, which is quite asymptomatic at that point. But we see a lot of adults getting hepatitis, which is very unusual. This year, we have got mostly adult groups, 30s, 40s. Even one person had got 65 years who had succumbed to the disease due to liver failure. So once again, I would try to highlight these issues of personal hygiene and vaccination, which will go a significant contribution regarding this prevention of this hepatitis A in our country. Thank you.